Broadcasting from New York City to the world, it's the G-Man Interviews.
Welcome. Jack Halpern is the CEO of the New York City-based My Elder Advocate, LLC. The organization provides advocacy services and helps seniors with issues such as eviction prevention, nursing home or assisted living placement, and long-term care planning. In March, Mr. Halpern was showcased in the episode Home Health Aides from Hell, which will be the focus of discussion for members of the New York State Standing Committee on Aging during its next legislative session, as confirmed by Senator Joseph Addabbo, Jr., who serves on the committee. Mr. Halpern recently asked the G-Man Interviews to meet with him to discuss what he described as a dangerous trend in New York nursing homes and those in other states that will lead to the eviction or deaths of Alzheimer's and dementia residents who need and rely on long-term care. The interview was conducted on May 22nd at My Elder Advocate's Brooklyn office.
What I wanted to talk about is the situation in nursing homes as regards long-term care. I think I spoke about this before. Hospitals are sending a lot more people to rehab in nursing homes. Now, let me explain rehab. Rehab is rehabilitation. It's a regimen of physical therapy and occupational therapy. Usually when somebody has either broken a hip or had a stroke or they've been dehydrated, they will need to go to a nursing home to receive rehabilitation, strengthen up. So the idea is for them to go home. Okay, that is not really what is happening in the real world. Many of the residents in nursing homes who have come there for rehab are not really being rehabilitated to go home. They're either rehabilitated to stay in the facility as long-term patients. Some of them do go home. Now, it is very easy for a hospital to send someone to rehab. They just say everybody needs rehab. And there are many people that can go home from the hospital, but the problem lies in the fact that they do not have the support at home. Now, if somebody wants to go home and receive their rehab from Medicare and receive some kind of support, they have a problem because Medicare provides very, very little support for home care. They will provide nurses' aid who will come in for 4 hours a day, 5 days a week, and nothing on the weekend. Now, for somebody who's just either had an accident or somebody who's been dehydrated, they're not getting the proper nourishment, they're not getting proper hydration at home, it is probably because they don't have anyone to remind them about this at home, or they don't have anyone to help them and make sure that they're doing what they need to be doing.
So no effective follow-up.
There's no effective follow-up. And the rehab that does come into the home is very ineffective. There's no equipment. It's more like exercises. 90% of the people that come into the hospital need more support. They need somebody to be there at least during the day and sometimes at night to make sure that they don't fall, that they get the proper nourishment, that they get the proper hydration, to make sure that they're taking their medication. And this requires the services of a home health aide for a much longer period than 4 hours a day. And generally, even with the 4 hours a day, these people will come in at a very inconvenient time. They might come between 10 o'clock in the morning and 2 o'clock in the afternoon, which is a very inconvenient time because the person still has to get up and dress themselves. They still have to prepare their own breakfast. The best that they can get is they can get a lunch out of the deal. They'll cook lunch for them and maybe they'll help them take their medication. So the home care is very inadequate. Now, Medicare, as far as providing for physical therapy and occupational therapy in a nursing home, the rules are that somebody who goes to a nursing home for physical therapy or occupational therapy gets up to 100 days that's paid by Medicare. They pay for the rehab, they pay for the occupational therapy, and for the physical therapy. And this is only if they are able to do the physical therapy. Now, the first 20 days is paid entirely by Medicare. The last 80 days are 80% is paid by Medicare, and 20% is paid by the patient themselves. The nursing homes who have, let's say, mostly Medicaid, now Medicaid is for people who are indigent. If you don't have money and you have to go to a nursing home, you're on Medicaid. Medicaid covers your drugs, covers your nursing home stay. Medicare is for everybody. So everybody receives Medicare as long as they're over 65 or they're under 65, but they're on disability. Now, a nursing home gets reimbursed for rehab services at a rate of $650 a day. A nursing home receives a little bit more than $300 a day for Medicaid. So obviously there is a strong desire by nursing homes to get as many rehab patients as they can. Now, if somebody does want to go home and they do want to get more care at home, today, if they're indigent and they can't afford to pay privately, they will have to apply for Medicaid and get somebody to take care of them at home. And that can take upwards of 2 to 3 months. So the hospital is not going to keep that person in a hospital bed and wait for 2 or 3 months till that person can go home. So the easiest thing is just to say that everybody's going to rehab. So what they're doing is they're shifting the responsibility to take care of these people from Medicaid or from home care to very expensive nursing home care, even if they don't need the care. The other problem is that many people who go to nursing homes, say after they broke a hip, or they elders, of course, after they've had a stroke, or they've had a hip replacement, or a knee replacement, they get such a short hospital stay before they go into rehab that they're not really in a position to do rehab. They're in a lot of pain. It takes them a lot longer to heal. So in many cases, they're coming to the nursing home. They're not ready to do rehab, but the nursing home has to push them to do rehab. So in a lot of cases, they will just give them painkillers. Now, of course, many nursing homes have good rehab people. They, do good work, and I'm not saying everybody, but a lot of nursing home operators are gaming the system, and they're giving more and more of their beds to these rehab people so that they can get the higher reimbursement. And the feeling in the industry now is that Medicaid is a loss leader, and Medicare, the extra money that they're getting on Medicare, is where they really get their profit. So what is happening, according to a number of articles in the newspaper, nursing homes are emphasizing their rehab. They're building up their rehab floors. They're making their rehab floors prettier with minimal staffing, or taking care of those long-term care residents who are mostly Alzheimer's people or people with dementia. Alzheimer's people and the dementia people are being isolated onto their own floors, being all put together, and they don't have any Alzheimer's programs for these people. They just have these silly activities like bingo and throw the ball around and little singing things. They have no stimulation, so they die a lot quicker because Alzheimer's and dementia are progressive diseases. They start at one stage where a person is just beginning to kind of get their head around having this memory loss, and they're very docile. And as the disease progresses, they become more active and they start wandering and they start what's called sundowning, where they don't know if it's day or night. So they'll sleep during the day and they'll be up all night, and they require a lot of staffing. So these people stay on their floor with minimal staffing and just sit around. They don't get any mental stimulation. There's no mental stimulation for these people except for very few nursing homes. And those nursing homes are the really private nursing homes that have mostly private patients that have wonderful programs. So I say, this makes me very angry, because if you're going to put money into your facility and you're only going to put it into those areas that provide you more profit, and you're not going to put it into those areas that can help Alzheimer's patients and dementia patients to fight their disease, it's all about the money. It's all about it's all about getting those rehab people. But what's happening is that many nursing home operators are now buying up facilities, building them into rehab centers. And what is going to happen is, as more and more facilities have more and more of their beds devoted to rehab for all those extra dollars, facilities are already beginning to say, we don't want any long-term care residents. Nursing home is not allowed to discriminate based upon method of payment. But a nursing home, they work closely with the discharge planners in the hospitals. And they have those nursing homes where they're going to refer people. And the discharge planners choose which people go to which facilities. So if they get somebody who's a private pay, they will send them to a good place for rehab. The other people will go to substandard nursing homes, unless they have an advocate who's going to be there at the hospital and say, look, they're only going to a good facility. They're not going to a substandard facility, even if they have to stay in. I've kept a lot of people in hospitals. But the point is, these discharge planners have to send these people somewhere, and their only concern is an empty bed. They can empty a bed in the hospital and fill a bed in a nursing home. That's all they want to do. They're not really looking. They don't really give the patient in the hospital, the elder and their families, they don't have informed consent. And the law says that as part of the discharge planning, the discharge planners in the hospital have to know everything about the facilities where they're sending people. They say to people, we don't know anything about these facilities. We're not allowed to say if a facility is good or bad. Well, if you're not going to tell somebody if a facility is good or bad, then on what basis do they have a choice? And discharge planners do not allow people the time to go visit facilities, even though they have to. They have to help them with the discharge process. It's not just finding them a bed in a nursing. But they have to get rid of the person, so they begin to pressure the family and say, hey, and they will tell the family, today is Friday, they will say, your mother is being discharged tomorrow. In other words, they will say, look, Medicare is not paying anymore. They have to go someplace. You have until tomorrow to decide. Here is a list of 75 nursing homes. Choose a nursing home. They're not allowed to stay in the families. The families become petrified. They're scared. They don't know what to do. And they say, okay, you have a bed somewhere? Send them. And it's only then that they find out that they've made a big mistake. And that person is now in this facility The rehab might be good. I mean, most of these people are professional people, but most of these people, they want them, they want them rehab. They want them to have 100 days. And if they're not going to do the rehab, then they begin to pressure the family. So let's say a patient comes in, they're in a lot of pain. They can't do the rehab. They'll try to force them. After a while, they'll say, look, we have to discharge them from rehab. So they have to go to another facility or they have to pay privately. And you got to put up 2 months of money. If the nursing home is only interested in the financial information, if they don't know what potential for rehab this person has, how can they accept them? But the reason is they will force the rehab on them, or they will tell them, you got to get out because you're not doing your rehab, or you got to pay 2 months privately. And if you just have a little bit of money, they'll take that money, and then you have to apply for Medicaid. And that process takes 3 months. I just had a patient in a nursing home. He has 6 months to live. He has very bad brain cancer, and he's been told he has 6 months to live. And he was accepted by that facility for rehab, and he can't do the rehab. He's not doing any rehab, but he's been rehabbed for 5 weeks right now. All he wants to do is stay in bed and sleep. Without family, it's just terrible. So now they're discharging him from rehab. Now they're saying to this guy, get out. Where's this guy going to go? I said, let him go to hospice. They will pay to do the hospice in the nursing home, but they don't provide room and board. So this guy has to find some private money. He has to deal with dying. And now in 4 months, he has like $20,000 that they know about. The rest of it is stuff you don't know because he came from the home into the nursing home. And he's never been home again. And he's lost his apartment. And the landlord will not allow his daughter into the apartment. He cannot pay the kind of money that you want him to pay for room and board in a nursing home.
And there are no safeguards in place.
No safeguards whatsoever. And the other thing is, if these nursing home operators are buying up every not-for-profit nursing home, and suddenly, over the years, if you look at it from 2010, when this wasn't such a lucrative business with the rehab, and you look at the amount of people that are going from the hospital to rehab, you will see this huge jump. Why isn't the federal government looking at this huge drain on Medicare and saying, hey, well, what is this? Everybody's going to rehab. What's going on? Why aren't they going home? New York State is saying, oh, you can't, it takes you 3 months to get home care. You want to go home for 3 months and lay in bed, then and apply for Medicare, we'll get you that. There's got to be some kind of balance. It's all clearly because New York State is looking to reduce its Medicaid dollars. So it's allowing all these people to build up these nursing homes and to buy other nursing homes, these profiteers. People used to go home because you could get home care on Medicaid in 1 week. You were in a hospital, you can go home, you can get an aid immediately, apply for Medicaid, get it immediately, and you were okay. So you would see that period of time from 2000 to 2010 when they had the ability to get Medicaid very quickly to get home care, you will see a downward slope in people going home. And now when it takes 2 to 3 months for somebody to get Medicaid to go home, it suddenly spikes. I mean, you don't have to be a brilliant statistician. They don't want to spend money on Medicaid. Governor Cuomo wants to say, look at all the money we're saving on Medicaid. they're going to a nursing home, and then they go home, and then they might have to pay privately, or they have to wait. So it's a system that is out of balance, and there are no safeguards. So it's triggering more money being spent by Medicare because 9 out of 10 times this person who goes home, if they don't go to rehab, let's say they go home, they're going to be back in the hospital very, very quickly.
And we'll start the cycle
You
all over
cannot
again.
send a stroke victim home without 24 hour by 7 days care. So they go back in the hospital. It costs more money on Medicare.
And you start the cycle all over again.
And you start the cycle all over again. 2 years ago, a syndicate of people started buying up not-for-profit nursing homes and governmental nursing homes. The governmental nursing homes lose millions of dollars. Why? They don't do a good job. They take everybody. And the people who run them get huge salaries. So these guys came in and said, we can buy it. Let's buy it. So the government sold the nursing homes. The state approves any sale regardless of the background. There are operators out there that have such a terrible record with the Department of Health and run all substandard nursing homes. They applied to buy a new nursing home. I've never heard of a nursing home sale not going through.
Not once.
Not once. And the State Health Planning Council has to take into consideration the past records. They don't do it. I mean, I've looked through the State Health Planning Council minutes years ago. You have a guy like Ben Landa from Sentosa Corporation, I spoke about last time. He was a member of the New York State Health Planning Council. He had to leave the room on many occasions because they were voting on his purchase of nursing home, and he built his empire. And this is in an article that I sent you about Sentosa. Howard Fensterman, who's a lawyer for Sentosa Corporation and owns a number of Sentosa facilities, is still on the State Health Planning Council. So everybody's getting approved. Why is Governor Cuomo letting everybody do what they want to do without any type of plan? Simple. He wants to say in his State of the State address, look how much I cut out from Medicaid. Hey man, where's the other side of that balance sheet? All the people that went to nursing homes. Oh, that doesn't count because they got paid on Medicare. But what happens to them after the 100 days if they can't go home? Does the nursing home say to them, oh yeah, you know what? We're going to let you stay here and apply for Medicaid for home care? No. The agencies who provide the home care are not even allowed to go and do an assessment in a hospital. So where are they going to go? So if they're in one of these good places that don't want long-term care people, they evict them. Or they send them to more substandard nursing homes. Or better yet, listen to this one. This will blow your mind. They have multiple nursing homes. Some of them are better in better neighborhoods. The others are bad neighborhoods. Some of them like are in the Bronx. So they keep all the good ones and they send the other ones to their more substandard facilities. The state has created this system whereby all the Medicaid people who need home health care or nursing home care were put into these managed long-term care agencies, MLTCs they're called. That's basically like an HMO. It's run by insurance companies who make the decisions about where they can go. And a number of these nursing home operators also own MLTCs. So what they do is they send those people that need nurse, let's say they're at home getting care, and they can't be taken care at home, or they go to the hospital, they break a hip. They force them into their own facilities. They don't give them a choice. They're supposed to get a choice. Now, if a nursing home operator is profiting from another agency that he also owns, that is a kickback. Nursing homes are not allowed to take kickbacks because they deal with federal and state funds. Governor Cuomo knows this. His people, I don't know him directly. So besides the fact that he's friendly with all these nursing home operators, and they all voted for him because they don't care who wins the election. They get money to both sides. Their only thing that they're looking for is which politician is going to be friendlier to the nursing home industry. And like I said last time, the American Healthcare Association is one of the top 5 most powerful lobbies in this country, and they spend millions and millions of dollars to get everything that nursing homes need and watering down the regulations and making sure that fines are reduced, everything. I hate to sound like a conspiracy nut, but I know what's happening. I mean, I'm out there. I know what's happening. I know how these guys are getting away with it. There used to be an unspoken rule in New York State: no corporate ownership of nursing homes. You didn't have these large conglomerates owning nursing homes in New York State. Then Pataki let that go. He said to Ben Landa and Howard Fensterman, hey guys, you can buy as many nursing homes. He owned 2 nursing homes before he was on the State Health Planning Council. And he now owns 25. Most of them were acquired during the time he was on the State Health Planning Council.
25.
25 substandard nursing homes with low staffing, profiteering, making probably $1 billion in Medicaid funds a year. Lives fat. Fat. Fancy house, fancy cars, everything. Gives a lot of charity, but only to his own cause. It doesn't give $1 towards improving care for the elderly.
You're really getting riled up behind this.
Because it's heading towards a point in the near future where, and I'm having this on a daily basis with my clients, I can't get long-term care beds for Alzheimer's people, for dementia people. These people cannot be at home. There's no one to take care of them. I mean, of course, I will keep them home, but they're poor people. They don't have families. They're suffering with Alzheimer's and dementia. They're forced into nursing homes. Most nursing homes do not want them anymore. And there's been this trend where nursing homes they can't say to you, I don't want an Alzheimer's patient. They can't say it to you. But the social worker in the hospital, the discharge planner, will tell them what the deal is. And then they say, I don't have a bed. I have had admissions people in nursing homes tell me quite frankly, I have a waiting list. Bullshit, you don't have a waiting list. But I'm paying privately. Can I do something about that waiting list? Oh, there's no waiting list for private patients. They're not hiding it from me. They're not embarrassed. Oh, they can pay privately? I tell people, keep some money aside that if you have to go into a nursing home, if you can pay for 2 months, you'll get into this good nursing home. And many of the nursing homes will tell you clear out, we don't accept long-term care patients. Now, how is that fair to the states, to the citizens of New York State who paid for these friggin' nursing homes out of their pockets? Why? Medicaid. Medicaid paid to build these nursing homes. New York State paid to build 615 nursing homes in this state. There was no such thing as rehab money years ago. Everybody went in there long term. They needed rehab, they got rehab, and after rehab, they went to, they stayed long term if they couldn't go home. or they got home care. This state used to be the most generous state. Cuomo is taking nursing home and hospital and the elderly in this state, and he is screwing the hell out of them. But he will not raise taxes, and he wants to keep his campaign promise. I'm going to lower Medicaid and I'm going to lower property taxes for homeowners. His father was an advocate. His father cared about the elderly. He took care of the elderly. He created the prosecutor's office. Well, it was actually Hugh Carey who started it, but he continued to go after bad nursing homes. New York State, the statistic that I read this week, 40% of the nursing homes substandard. According to officially, they're below 3 in the rating system, 2 and 1. And nobody's punishing these guys. Nobody is saying, you have a 1, you have a 2, you're out of business, Charlie. They used to do it. They would say to them, hey, you're not getting any more Medicaid dollars until you shape up. Oh, we're going to put a receiver in there. And they put receivers. Today, if you have in Texas 55% are below 3,
55%.
55% in Texas, and you have 40% in this state. What's the purpose of the rating system? There's 600 nursing homes in New York. You're telling me that 40%, 120 nursing homes, where patients are in danger for their lives.
Literally.
Literally. If you're below average.
Is the discharge planner required to tell the patient's family what the rating is?
They probably are, but I don't think that there's a law that says they have to. And many people don't know about it. But the problem is that even if somebody knew about it, and they went and they saw that the place had a 2-star, and they went back to the hospital and they said, look, this place has only a 2-star, we're not going there. You have to pick another place. So what are you going to do? You're going to go to a rating system based upon stars? No. The stars are supposed to be a starting point. The discharge planner is supposed to give you the amount of time so that you can go check out these places. You think because a place has 5 stars that it's a good place? Not necessarily.
Well, and based on what you said earlier, if they're told that they're going to have to move them tomorrow, you don't get much time to go and check out a facility anyway.
You don't get any time. Oh, you got to go right now. Well, I got to work right now. Well, I'm going to go on the weekend. I tell the discharge plan, if they have me as an advocate, I say, they're going to have all the time they want. There's nothing that you can't do. And people out there have to be, really, if they're listening to this, the discharge planner cannot take this elder and put him in the street. So all their threats that they make to you are empty threats. They will threaten you that the bill's going to come and this and that. It's all empty threats. It's only the way they say it. If somebody in authority says something to you, you believe it. This is the discharge planner. You're going to take your mother home. In your mind, there's no place for argument. This is a person in authority. That means if I have to take them home because they're going to take them and they're going to throw them in the street. No, it's not going to happen. And the people that get to safe nursing homes are those people to say, no, I'm not taking my mother until I do my due diligence. But most people don't have the time and they don't know the laws. So a lot of people are getting lost. But my biggest concern in my discussion today is that at this rate, people with Alzheimer's, people with dementia, people who don't have families are not going to have a place to stay. We're not even talking about programs in nursing homes. How the state can allow people to be in a nursing home and have Alzheimer's disease or dementia and not have a qualified Alzheimer's professional in that facility as a requirement of the law is unconscionable. I mean, it is taking a society of people and saying you have to go to a nursing home where not just aren't you going to have your needs taken care of, your disease will get worse and worse and worse, and you will die much quicker than if you were in a nursing home that has an Alzheimer's program. There's a nursing home in Brooklyn that has an amazing Alzheimer's program. I have put people into that nursing home, and their illnesses have stopped. They use iPads, they use music, not just music, having some guys singing the oldies but goodies in a nursing home. They find out the music of these people's past. They find out what they were like. They found out what they liked then. And they stimulate. You give an Alzheimer's patient an iPad, and you have given them life. A simple little iPad. But it has to be with people who understand the disease. And this place in Brooklyn was recently bought. They're not-for-profit. And the New York State Department of Health has been cutting their reimbursement to the point where they were spending more than they were making because they kept all the laws. They kept full staffing all the time, but they couldn't make money. So they sold to these people who will probably get rid of the Alzheimer's program because it's very, very expensive, and they will decimate these people. It'll be like these cities in China that are overrun with elderly who walk in the street without any support. If you can't get into a nursing home, even the bad nursing homes only want rehab people. You have to create a system where it's not the facility's choice. Medicare wants both sides of this deal. On one side, they're pushing people out of hospitals. Go, go, go. On the other side, they're not regulating nursing homes. I'm not saying that the people in the hospitals are doing this because they hate people. They happen to be people that are hired specifically, who are nasty and hired specifically to kick people out of hospitals, and many of them are very nasty. They're young, they'll take any job, and that's what they do. Because it's the reimbursement is pushing them. In a reimbursement-based healthcare system, everything is based on reimbursement. There's no room. If I keep this person in a hospital a couple of extra days so that they could find a good nursing home, I'm not going to get paid for those days.
As far as the Alzheimer's and dementia patients being forced out of the nursing homes and not having any place to go, how likely is it that they'll end up in mental institutions or facilities?
Very likely. It's very likely that they could end up in psychiatric institutions or end up in any place that has a bed. Or they will end up on the streets. I mean, I have one recommendation, that every single nursing home be limited in how many of their beds can be allotted to rehab. Okay, I have a nursing home in Long Island who told me straight out, we don't want long-term care. We'll evaluate it and we'll see if we have a bed. That means they don't want that person. They have 200 beds and they already have. They keep applying for approval for beds and receiving them. They have 70 beds already dedicated to rehab. And many of them, the rehab is not even on a separate floor for rehabilitation. You know, you can't take rehabilitation patients and put them on the same floor with your long-term care people, because a person has to be in an environment of rehabilitation to be rehabilitated. You take somebody who's not really sick, who doesn't have Alzheimer's, and you put them on a floor with Alzheimer's and people that are screaming and yelling and have to go to the bathroom every 5 minutes. You can't do that. You have to have a rehabilitation unit. A lot of them now have rehabilitation units, but they devote most of their efforts to the rehabilitation units, which need less care. They're just there for rehab. And you're taking all your long-term care people and concentrating them, and you're putting Alzheimer's and dementia people with people that have Parkinson's and people who are young and people that are old. There's no rhyme or reason, and there's nobody regulating it saying, hey, they still have to have a life. If a person's going to go in a nursing home and they're not Alzheimer's, they're not dementia, and all they see is dementia people, and they see younger people, and, it's a system that is getting worse without any checkpoints. Politicians are saying, hey, look, when I need a bed for my mom and for my mother-in-law, I'm going to find a good nursing home. I'm going to get in.
Close out this episode by speaking directly to the governor. What would you like to say to him?
I would say to the governor that he has absolutely destroyed long-term care. We're number 37, and he has to have this Medicaid redesign team. Instead of redesigning Medicaid, he has to redesign a healthcare system that meets the needs of the elderly in this state who have been tax-paying, hard-working people. And just because they can't afford expensive care in their elder years does not mean that they have to receive this terrible, terrible, unchecked, low-quality, dangerous, unsecure, undignified, uncaring type of care. Then you have to look at both sides. You got to look at the dollars, and you have to look at what we need to give. If you cut out the fraud, then you cut out a lot of these things and turn it and give a fair shake to the middle class. It's all about the middle class. Not asking you to change the laws. I'm asking you to enforce the laws regarding elder care in this state are very, very clear about what these people are supposed to get and what their rights are. You have to start making sure that there's somebody out there enforcing the laws, and those people who are not enforcing the laws and gaming the system are to be put out of the system and penalized and taken out. This is not a profiteering business. This is a business that's about people, and you have to care about these people. Otherwise, your legacy will be one of a governor that found a good system, and instead of changing the things that were bad with that system, just change the whole system to the detriment of hundreds of thousands of elderly citizens in New York State. I have been in this industry for 41 years, and when I started out, this industry was a highly, highly regulated industry. Nursing homes were places, for the most part, that were good places that cared about people. And as the reimbursement system has changed over the years, and people and nursing homes today are just doing what they want, it's the Wild West out there, I am very, very concerned for the first time in my life that I see that people will actually be in the streets without places to go, without long-term care, and it's happening soon. It scares me. And if something doesn't happen, then we will not be able to take care of our elderly residents. The governor should stop listening to people that give him the money, and he should start listening to the advocates out there that are many who know exactly what's happening in nursing home and should take himself to Split Rock Nursing Home or another one of these nursing homes that are considered bad and see for himself what's going on.
How can people reach you?
They can reach me at my website, which is www.myelderadvocate.com. We provide a whole bunch of advocacy services. We are a fee-for-service company. We are a franchising company. We're franchising across America, hopefully to change elder care in America and across the world. You can call me at 212-945-7550. Reach me, call me, email me. My email is jhalpern at myelderadvocate.com. And I really want to thank Gary, who is a true journalist without a profit motive, and he is really bringing those issues to the fore that are important for people to know. And when things are going to get as bad as I think they are, and I believe they are, you remember that you heard it here first. He is performing as great a service as I am. So if you can't get me, reach him and he'll get to me. Okay? Thank you.
Thank you for being here once again, Mr. Halpern. I greatly appreciate it.
My pleasure.
I'm the G-Man, and I thank you for joining me. Until next time, stay cool, stay safe, and stay informed.